I'm going to explain prospective payment in health insurance. And to think about this, it's helpful to use a timeline because prospective payment basically means looking forward is the perspective of that, and it will be contrasted with retrospective payment. So let me rate those two definitions. So prospective payment here is looking forward in time, that is, and retrospective payment is looking back. So we're imagining a patient who enters the hospital, and when they enter the hospital, they're given a list of diagnoses. You have to know what you're treating before you can actually treat the patient. And then after they get their diagnoses, they get treated, the patient leaves the hospital, and the hospital bills the insurance company for this hospital stay. So retrospective payment is the more straightforward one. That is where the hospital says, these are all of the treatments that we did for the patient. And if it's surgery, if it's inserting catheters, whatever happened there, the hospital sort of charges the insurer line by line for each treatment to the patient. That's retrospective. And you might imagine, why is that retrospective? Well, you have to know what the treatments are. Basically, the patient has to have left the hospital before you can come up with that bill. So what is prospective payment? Prospective payment is actually looking at this moment in the hospital stay. Prospective payment is basically looking at the list of diagnoses that the patient has. So you can actually get this before the patient has even been treated. Before all of this has happened, you submit a list of diagnoses, which might be heart failure, diabetes, anxiety, whatever the diagnoses the hospital comes up with. And instead of billing the insurer for the treatments, you submit the list of diagnoses, and the insurer will pay the hospital based only on the list of diagnoses. That's prospective payment, because it's sort of like looking ahead to the rest of the hospital stay. How much on average will the hospital spend treating the patient with standard care for that list of diagnoses? So let me summarize that down here. Prospective payment is payment based on the list of diagnoses. Retrospective payment is payment based on the actual treatment. Now, you might ask, why use prospective payment? And one of the reasons, of course, is because if you pay based on the treatments, then there's an incentive for the hospital to do more treatments than is necessary, just to make more money. And so by switching to prospective payment, where you're paying based on diagnoses, the insurer can sort of come up with what is appropriate treatment for patients with these diagnoses. And there's going to be some risk there. It could be that with these diagnoses, about 20% of patients need surgery, and the rest just need medications and monitoring and some consultations with the doctor. So the prospective payment, the amount that the hospital gets, is based on the average patient. And that average is calculated assuming 20% of patients in that category need surgery and 80% don't. So you can see with prospective payment, the risk is borne by the hospital. If the hospital gets way more patients that need surgery than average, then the hospital could lose money because they're not getting enough, they're only getting enough for 20% of patients to get the surgery. So it does shift the risk from the insurer to the hospital, but it incentivizes sort of hospitals watching their budgets and making sure they're only giving necessary treatments. Now, you could say there's a problem with prospective payment because the hospital is losing out dollar for dollar for everything they use to treat the patient. So if the standard of care is that 20% of patients should get the surgery, the hospital will notice, well, we're getting the same payments no matter how many of these get surgery. So if we reduce the number of patients who get surgery to 10%, then that extra money that we're not spending on that expensive surgery, paying the surgeon and paying for all of the equipment, that's money in our pockets. So while retrospective payment incentivizes hospitals to do more treatment than they otherwise should, Prospective payment incentivizes hospitals to do less treatment than they otherwise should. And when prospective payment was first introduced in the 1980s, there was a lot of worry that this would really harm patients. Now, of course, the safeguard here is that doctors are a little bit less in the hospital setting, less involved with the payment, so the doctor cares about the patient more so than the billing. And that separation between the doctor's decision about what to do with this patient and the medical billing is a safeguard for the patient against undertreatment. But the incentive for undertreatment is still there. It's just that when they introduced prospective payment, or the DRG system, by the way, in the 1980s, there didn't seem to be a sudden drop in quality of care, and therefore this has persisted as a very, very common way for insurers, both Medicare and private insurers, to pay hospitals. So that's an overview of prospective payment in health insurance. It's a super important concept if you're going to become an actuary or a healthcare administrator of any sort.